Distinguished guests, ladies and gentlemen, for those who don't know me, my name is David Sando. I'm a prostate cancer survivor. I'm currently the National Deputy Chairman of the Prostate Cancer Foundation of Australia, and I'm co-leader with my lovely wife Pam, who I can't see over there, of the Prostate Cancer Support Group at the Sydney Adventist Hospital. Before we get down to the business of the day, we've all heard the latest ringtones on mobiles, so we don't need to hear them today. And if you wouldn't mind, if you haven't done so already, please turn your mobile off or move it to silent mode. This is a very special occasion. On behalf of Urology Australia, the Prostate Cancer Foundation of Australia, affectionately known as PCFA, and the Urological Society of Australia and New Zealand, also affectionately known as USANS, we welcome you to the launch of Prostate Cancer, Your Guide to the Disease, Treatment, Options and Outcomes. I now have great pleasure in introducing Dr. David Malouf, President of USANS, and I'm told he's the youngest president. He certainly looks young, ever, and he's fresh and from the very successful USANS scientific meeting, the annual meeting in Perth last week, which Pam and I, along with others here today, were privileged to attend, with over 600 attendees from Australia, New Zealand and many other countries. PCFA, fortunately, was one of the sponsors of the scientific meeting, as we recognise the status of USANS as the peak professional body for urological surgeons. PCFA and USANS are now in very fruitful discussions on future collaborations, as we see excellent opportunities working together. Dr. Malouf trained in Sydney, London and Seattle, and he's been instrumental in establishing the brachytherapy practice at St George Private and Public Hospitals here in Sydney. He serves on a number of overseas organisations, international committees, especially to do with urological care and particularly prostate cancer. So over to you, David, to say a few words to introduce Associate Professor Prem Rashid.
Thank you, David. General Peter Cosgrove, Mr Graham Johnson and Mr David Sando, Chairman and Deputy Chairman of the PCFA, members of the Board of Directors of the PCFA, colleagues, ladies and gentlemen. The Urological Society of Australia and New Zealand is pleased to be involved with the development and launch of this important book. Now in its third edition, Prostate Cancer, Your Guide to the Disease, Treatment Options and Outcomes, is an invaluable resource for patients and their families. USANS was founded in 1937 and is the second oldest professional urological organisation in the world. Education is our primary activity, education of trainees and ongoing education of urological surgeons. We recognise that we now have a wider role as an advocate. As advocates for our patients, USANS interacts with government in the formulation of health policy relevant to the urological domain. As an example of this, USANS has taken a proactive stance in informing men and their doctors of the benefits of prostate cancer testing from age 40 onwards. There is strong evidence that a single test at age 40 can predict a man's future risk of developing prostate cancer. As a patient's advocate, we have also taken a strong stance advising men of the risks of entering into financial arrangements with commercial impotence clinics, where profit takes precedence over good patient care. A new challenge we have undertaken is public education. Lifestyle health programs and publications and the widespread use of the internet means that the public has access to a huge volume of information regarding health. Unfortunately, some of the material is unscientific or of questionable accuracy. This is where publications such as this book have an important role. Professor Rashid has put together a well-researched and highly readable book which will help men and their families through their entire treatment episode. It is my pleasure to introduce Professor Prem Rashid. Prem undertook urology training in Perth, Adelaide and in Cardiff in the United Kingdom. He's published in peer-reviewed medical journals and is extensively involved in teaching of medical students and training in urologists. Somehow amongst all of this, and being a father and a husband, he's written several patient guidebooks and having been through this book extensively, I believe that this latest work is his best yet.